changer is called Filmit fine lines, because the problem is with the toxin use, we relax muscle activity. And with our patient, which I will show you later, we will see that a relaxation of the frontalis muscle results on droopy eyebrows. And patients return to you and say, okay, you injected Botox and I'm not happy with the result. With fillers, with fine lines, we have the full movement of the muscle. And this is what the patients love. They say to me, oh great, it's a real alternative. However, if we use this alternative, we have to respect anatomy. So the area in the midline is all a problem, and you should not inject deep there. And this is a well-known problem, please respect it. It's the most dangerous area here. We address also the forehead, but if you use Botox for the forehead, the eyebrow will go down, and you see there will be a tired look. You see? Just look like here, tired look. And that's why we try to put here only fillers. This is the best patient. If you see a patient who has skin excess in the upper eyelid, use fillers instead of toxin. This is the perfect way. It's a game changer for your patients. They will love it. To check where the lines exactly are, and I go in a very shallow way, means parallel to the skin, to create a space. Intradermal injection. You see where my needle is, and then you retrograde way of putting volume, and you see this little bolus here, immediate massage, and then I'm working towards the front. Of course, a 30 gauge needle is more painful than a 32 gauge. Sometimes I'm using a 33 gauge even, but I have to have a very high pressure on my plunger. Aspiration, one thing about aspiration. Aspiration is, if you inject intradermally, is not needed. If you go deeper, like bolus injection on the bone or something, I would always aspirate, but we know that aspiration has also false negative. I tell my patients, you will see a visible effect immediately. However, if the line is already static, then the effect will turn out also in a better way in some days, means 14 days to 30 days. You will see an even better effect, because the collagen synthesis takes part after 1 week, and you need time. The skin needs time before you see the final result. That's why I usually perform also touch-ups if needed, and after 14 days the patient can come and we check again. Because Tyndall is a breaking of the light, and it's a bluish showing up of the colors in the filler, but I never saw this. Did you see it?
Yes, it's no, the Tyndall effect, you know, because with our products, I've never heard. And we didn't have with the other products, the dense products. It is because if you inject it very superficially, it is possible to have, and you can correct it with Hyaluronidase. This is not a very serious and non-reversible problem. But I asked this question, you know, voluntarily, because this is another advantage of the fine lines. And as you show in the beginning of your session, it can really be resolved in the tissue, so you don't have this Tyndall effect with fine lines. If you want to treat the front with the toxin and with filler,
Right.
Which product you use, first?
So first I am using the toxin.